My name is Dr. Al Benson, and I'm a professor of medicine and a GI medical oncologist at the Feinberg School of Medicine of Northwestern University and the Robert H. Lurie Comprehensive Cancer Center. The management of patients with carcinoid syndrome can be a challenge. Um, for these individuals, certainly one of the most important interventions is the utilization of somatostatin analog therapy because it's certainly been shown that with octreotide and lanreotide that patients can experience significant reduction in flushing and diarrhea. I would also add for patients with diarrhea, keep in mind the etiology of the diarrhea may be multifaceted. For example, many of these individuals, of course, have intra-abdominal disease that may be interfering with their bowel function. They may have motility disorders resulting in diarrhea. Also, particularly patients on somatostatin analog therapy may develop steatorrhea. And for those individuals, control of the steatorrhea with pancreatic enzyme therapy may be beneficial. People on somatostatin analog therapy may also have diarrhea secondary to their somatostatin analog therapy. And so it is important to distinguish what you think is the etiology of the diarrhea. But certainly overall for patients with diarrhea secondary to carcinoid syndrome, somatostatin analog therapy can be very helpful. If people have stabilization of their actual tumor as evaluated on imaging, somatostatin analog therapy may not only improve their carcinoid syndrome, but result in stabilization of their disease. For people who have evidence of disease progression and therefore more difficulty from carcinoid syndrome, we do need to think of what other anti-neoplastic interventions may be useful. So for example, many patients with carcinoid syndrome have extensive liver metastases. And so offering a liver-directed therapy, such as with yttrium-90 radioembolization or bland or chemoembolization, may provide not only improved control of their liver metastases from the intervention, but may also result in reduction in the carcinoid syndrome with less flushing and diarrhea, for example. I would also note for people with carcinoid syndrome, it is important to make sure that they do not have carcinoid valvular disease, and these patients do need to be evaluated with echocardiograms to look for the presence of valvular disease and referral to cardiologists for optimal management for those who have significant valvular disease. Also, for people, the use of drugs like loperamide for their diarrhea can be helpful. And there's also the agent, the oral agent, telistrestat, that may be helpful to improve the control of the diarrhea. Certainly, if people have intra-abdominal disease that may be contributing to the diarrhea, and it's possible to consider surgical resection, that may be helpful for people to control at least a component of the diarrhea they're experiencing, and is something to consider. Unfortunately, many individuals with midgut carcinoid disease have unresectable disease, and that is not an option for them, but something to consider.